Good evening, everyone, and thank you for joining us. Tonight, we're going to speak about sleep hygiene and the negative effects of sleep disordered breathing. I am David Philman. I am the Director of Cardiopulmonary and Sleep Services for WVU Medicine, Berkeley, and Jefferson Medical Centers. Getting a good night's sleep is important in maintaining good health. We all need a certain number of hours of sleep every evening, and we all fall into bad habits that prevent us from getting a good night's sleep. I would like to go over at this time some real simple changes in habit that can help get a good night's sleep. The first is we need to maintain a regular sleep routine. And what I mean by that is basically going to bed and waking up at the same time, give or take 20 or 30 minutes every day of the week, including weekends. Avoiding naps if at all possible. And the reason why we want to avoid naps is that actually decreases our sleep debt, which can actually delay the onset of sleep and cause fragmented sleep. Each of us needs a certain amount of sleep in a 24-hour period, no more, no less. When we take naps, that kind of decreases our sleep debt, and that can cause delayed onset of sleep, sleep fragmentation, and can actually lead to insomnia. There are some other things. For example, if you find yourself laying awake in bed, you should do no more than 5 to 10 minutes of laying in bed awake. If you find your mind racing, you want to get up out of bed, sit in a chair, sit in the dark, allow your mind to race to get those thoughts out of your mind, and do not return to the bed until you are sleepy. You also do not want to watch TV or be on your tablet, your laptop, your phone during these time periods. You want to avoid anything that is going to stimulate your mind during these periods. If it happens several times a night, that's actually okay. You just want to make sure that you are maintaining your normal sleep routine and avoid naps if at all possible. As I said earlier, you don't want to watch TV in bed. Be on your tablet, be on your laptop, be on your phone. Try to avoid reading. And the reason for this is that your mind then associates the bed with a state of wakefulness instead of sleeping. According to the American Academy of Sleep Medicine, the bed is reserved for one of two things. One being sleep. I'll let you guess at the other. Other helpful hints to maintain good sleep hygiene. You do not want to drink caffeine inappropriately. The effects of caffeine can last in our bodies for up to several hours. Caffeine will cause sleep fragmentation. It will delay the onset of sleep. It will be difficult to initiate sleep. So if you do drink caffeine, A good rule of thumb is try and not drink any products with caffeine after, say, noon or lunchtime. Remember that soda, tea, energy drinks, they also contain caffeine. So you want to try and avoid those types of drinks if at all possible. Avoid inappropriate substances that can interfere with sleep, such as cigarettes, alcohol, some over-the-counter medications. They can all cause fragmented sleep. So what can I do with the physical environment of my bedroom? The bedroom should be dark. You want to turn off bright lights. Also, a cooler bedroom tends to be more comfortable than a warm bedroom. You can purchase some blackout curtains. They are helpful if you're sleeping during the day. For example, you work night shift, you sleep during the day. It's a little difficult when bright sunlight is coming through the windows for you to sleep. If you're a clock watcher at night, turn the clock around so you can't focus on the time. And have a pre-bedtime routine that helps you unwind and helps your mind and body prepare for sleep. And try and maintain that on a consistent basis. Next, we want to talk about some of the negative effects associated with sleep disordered breathing. The first one is high blood pressure. If you already have blood pressure, sleep apnea can make your high blood pressure that much worse. When you wake up often at night, your body becomes stressed. That makes your hormone systems go into overdrive, which will increase your blood pressure. Also, the level of oxygen in your blood will drop, and that can further increase your blood pressure. Treatment can make a difference. So if you have high blood pressure and you suspect that you may have sleep apnea, getting treated for sleep apnea may improve your high blood pressure. Some people are actually able to have their doctors or providers decrease the amount of medication, but I must caution you should not change or stop taking medication without your provider's advice or talking to your provider first. Another negative effect associated with sleep disordered breathing is heart disease. People with obstructive sleep apnea are more likely to have a heart attack. The causes may be due to low oxygen levels or the stress of waking up often. It should be noted that strokes and atrial fibrillation or a fast fluttering heartbeat are also linked with obstructive sleep apnea. So if there is a history of heart disease, we really need to look at, is there a component of sleep apnea that's contributing to the high blood pressure, the heart disease, or atrial fibrillation? Sleep apnea does interrupt how your body takes in oxygen. It actually makes it difficult for your brain to control how blood flows into your arteries and the brain itself. Type 2 diabetes. Sleep apnea is common among people with this condition. It is estimated that at least 80% of patients with type 2 diabetes have obstructive sleep apnea. Obesity will also raise the incidence or the risk for both disorders. Studies haven't shown a cause and effect link between sleep apnea and type 2 diabetes, but not getting enough shut-eye or sleep can actually interfere with how your body utilizes insulin, which will lead to diabetes. Some other negative effects associated with sleep disordered breathing and not having it treated. Weight gain, okay? As mentioned before, weight gain can increase the chance of diabetes. It can also increase the chance of having sleep apnea. Extra pounds, we all know, can increase that chance. Adult asthma. Science has not proven it, the link between sleep apnea and obstructive sleep apnea. There are some studies out there that suggest people who do get treatment for their sleep apnea actually have fewer asthma attacks. Acid reflux, again, there's no proof that sleep apnea causes this type of heartburn or acid reflux, but many people say it's a problem. There's sleep doctors say treating the sleep apnea actually will improve the symptoms of acid reflux. Car accidents. When you feel groggy, you actually raise the risk of falling asleep at the wheel. People with sleep apnea are up to 5 times more likely to have traffic accidents. Let's talk a little bit about the economic burden of sleep disordered breathing or sleep apnea. It's estimated, and this is probably on the low side, obstructive sleep apnea affects an estimated over 29 million men and women in the United States. Diagnosing and treating every patient would produce an annual economic savings of over $100 billion each year. That's a significant amount of money. The economic burden of undiagnosed and untreated sleep apnea is all but $150 billion. $87 billion in lost productivity, over $26 billion in motor vehicle accidents, over $6 billion in workplace accidents, and $30 billion annually in increased healthcare utilization and medication costs related to not treating sleep apnea. So there are not only just medical reasons for it, there are financial and economic reasons for it. So how do we go about finding out if someone has sleep apnea? If you have symptoms of sleep apnea, or a family member shares concerns about symptoms that may have been observed, most times it is the bed partner that actually talks about, oh my gosh, my husband snores so loudly, sometimes he stops breathing. That is the most reliable person to report that there may be an issue with sleep apnea. If any of these signs have been observed, you should be contacting your physician and speaking to him or her about it. Examples include, but not limited to, so this is not a complete list: snoring, particularly loud snoring, your bed partner actually witnessing the person having apneic periods or they stop breathing, excessive daytime somnolence. That means you are just so sleepy during the day. You could have gone to bed at 8 o'clock at night, woke up at 6 o'clock in the morning, and you feel as if you haven't slept at all. Based on your symptoms and your health history, your physician can test you for sleep apnea. These tests can be performed either at home or in a sleep lab. Your physician will choose the most appropriate test for you based on your symptoms. I can tell you the most common pattern of how people are tested is that they will have a home study done first to either rule in or rule out sleep apnea, and that just involves you coming to the sleep center. We have a little device, we input all your information into it, provide instructions, you take it home, you turn it on when you go to sleep. The next morning, it's brought back to the sleep center. We download the data. That way we are able to rule in or rule out by a boarded sleep physician if you truly do have sleep apnea. If that is the case, then there's going to be further diagnostic tests performed. There are a couple of screening tools that are used based on daily activities. For example, the first one is the Epworth Sleep Scale, and it's on a scale of 0 to 3. Sitting and reading, how likely are you to fall asleep? Watching TV, how likely are you to fall asleep? Sitting in a public space, for example, you go to the movie theater, are you actually watching the movie or are you falling asleep? Laying down to take a rest in the afternoon, sitting and talking to someone, do you fall asleep? Sitting quietly after lunch, provided there's been no alcohol consumed. In a car while stopped in traffic. You tally up the score, and really any score greater than 10, you should be talking to your physician about the possibility of having sleep apnea. Another scoring tool that we use is called the Stop Bang, and it's literally yes or no questions. Do you snore? Yes or no. Do you feel tired, fatigued, or sleepy during the day? Has anybody observed you falling or stop breathing in your sleep? Do you have or are you being treated for high blood pressure? A body mass index of greater than 35. Are you older than 50? What is your neck size? Neck size is more than 16 inches, typically correlate with a higher chance of sleep apnea. And gender, male. Males typically have a higher chance of sleep apnea than females, although it is common in both sexes. If you score a 0 to 2, your risk is low. If you answered yes to 3 to 4 of the questions, it's considered moderate. And if you answered yes to 5 to 8, that's high risk. There are various treatment options to treat sleep apnea based on its severity and any underlying medical issues. Sometimes for patients with mild sleep apnea, an oral device or a little bit of supplemental oxygen at night may be effective. In some instances, what we call positional therapy, which is just a fancy way of saying sleeping on your side, will be recommended. When you lay on your back, you are more likely to have your airway partially or completely collapse. For moderate to severe sleep apnea, positive airway pressure therapy is the treatment of choice. There are 2 types of positive airway pressure therapy. CPAP, which is continuous positive airway pressure, and it just provides a continuous level of positive pressure to keep your airway open. In some instances, we may have to use what is called BiPAP, so that there are 2 levels of pressure. There is a pressure that is maintained constantly, and then when you take a breath, there is an additional pressure provided to help you take a deeper breath. There may be an adjustment period with this type of therapy before an optimal setting can be achieved or determined. The most important factor with positive airway pressure therapy is finding the correct type of mask. The correct type of mask, as I said, is most important. If any of you have a mask that you're not comfortable with, you're not going to use the device. And if you're currently being treated for sleep apnea and there is an issue with the mask, you need to be talking to your provider about that. For some people who cannot use positive airway pressure therapy, there's a new device out on the market called the Inspire device, and that may actually be recommended by your physician. As I said, it is a newly developed device. It is implantable, that allows people to forego the positive airway pressure therapy. The criteria for the Inspire device, though, is very specific. That's probably a better choice of words than strict. There are very specific criteria. So it is not for everyone, and that will involve a separate evaluation process by an ear, nose, and throat provider.